Hello, everybody. I've been holding on this for a while, debating on what I want to do. But this came up. This guy here, T-Rev, 757. He's the one that I was telling you about when Madeline Zolo came up missing and she was found and stuff like that. He had phone call from supposed friends of Stephen Stearns, but turns out he kind of bet someone to call him in for that. And this guy here was in thick with Seth. Seth doesn't pick too many good people. This guy is not no longer in that thick with Seth because of things that's happened with that. But Chris Proudfoot and Katie Proudfoot, the people that suck up to them, one was caught saying racial slurs and stuff on her channel. So yeah, it's coming out. I don't like any of these people. I mean, these people on here are something else. And they go, oh, this is too grimy. Try to tell you what to do on here and stuff like that. You're not supposed to, trying to say they're the brightest bulb in the ceiling, but they are not. So, and I'll do whatever I like because they're not my boss. But I wanted to bring something up that I thought was very interesting, and it dawned on me because I heard um, um, Seth speak of this certain thing. But we'll get into this right here. All right, is either schizoaffective disorder, uh, bipolar. What that is, schizoaffective, is a borderline between schizophrenia and bipolar disorder, bipolar type. See, but I'm not saying that's what he has, but Sebstian Rodgers I'm talking about. But I was thinking that maybe he, because I would like to know, but they don't have to say, but was he tested for um, autism? Because autism usually starts out when they're young, and he was supposed to be tested at 12, 13. But what age can autism be reality diagnosed? Okay. Many parents wonder about parental or potential signs of autism in their little ones. But at what age can autism be really diagnosed? And is it worth stressing about before then? Unlike many other chronic disorders, there is no medical test that can give parents a clear answer on whether their child has autism. Instead, parents, caregivers, and medical providers look for developmental signs that emerge as the child ages, and these signs may or may not present in the early months for years of life. About in about 1 in 44 children will receive an autism spectrum disorder, ASD diagnosis. And with so much prevalence, it makes sense that parents might feel concerned, especially their child does not appear to be hinting development milestones. At the same time, rate as their peers. However, not all developmental delays means autism, nor do they mean that the child won't eventually catch up. Then how early can you detect autism? Here's what parents and caregivers need to know. Does autism show early? Common question that persons for pediatricians tracking developmental milestones, particularly those related to social and emotional development, an important part of monitoring child's health in the first few years of life. And while many parents are quick to assume that something major is going on, if things appear to be on track, it's helpful to be aware of them or of when autism can really start to show up, well as that it looks like. Autism can show early, but the earliest age for autism diagnosis reliability is not until a child is 2 years old. It's essential to keep in mind that the accuracy of evaluations based on early signs of ASD can be hit or miss. And before age 2, it is possible that children who present with these signs may go on to be neurotypical. Okay, some of the early delays that are most associated with a later diagnosis of autism include failure to make eye contact, strong negative reaction to changes in routine and environment, limited communications related to age and peers, lack of interest in social interaction with caregivers. It doesn't sound like Sebstian though. If you are a parent, those child is exhibiting one or more of the early signs of autism, speak with your pediatrician for additional guidance on what you can do. Early screenings and interventions can be incredibly valuable for children with ASD, but before a certain age, you may just be advised to continue paying close attention. Now, I remember, and I think it was Seth that said this, but right here, Risperdone poisoning. This here is what they call Risperdone. Risperdone is something they use for bipolar. They can use it for autism and stuff like that. The thing is, if you take these are antipsychotic drugs. Did they test him for seizures? Did they test him for heart A lot of different tests have to be done before they give these pills out. And I heard somebody mention this one of the parents. And this is used for bipolar. And it would seem to me that bipolar now all the stuff that this young man has been through throughout his 15 years of life, um, and his current status when he was living with his mom and his stepdad, it brings me to question because um, by what the stepdad said, and I hear people and they stick up for this CP, they stick up for him and say, "Oh, he's never said anything bad about Seth." He did. He did. He yelled at him, and I've seen it. Yeah, he's got issues with his anger. He absolutely does. Seth has issues too. They both. I don't agree with either one of their behaviors, but I think something happened with this particular pill here because Seth was talking about sleep aids, but I, for one, do not believe a person is going to prescribe sleep aids, and a lot of insurance companies will not cover it. Sleep, if they were getting state help for Sebastian, it won't cover sleep aids. And sleep aids, I don't think they would prescribe them. It would be something like this, and he mentioned Risperdone, and they probably thought Risperdone was a sleep aid, but it's not. It's a mood stabilizer. And Chris and Seth says he has a problem with mood. Either you're high or you're very low. You get angry and stuff like that. And I don't think he was getting the right type of care that he needed and support that he needed from a psychiatrist or something like that, and a therapist and things like that. Children requiring assessment. Any systematic patient, acute uh, ingestion of unknown quantity. All children with uh, deliberate self poisoning or significant accidental ingestion. As, urgent assessment is required for all children who may have ingested the following uh, and drug naive children. Less than 12 years of age, an ingestion of 1 milligram should be considered potentially toxic. 12 years or older, an ingestion of more than 5 milligrams should be considered potentially toxic. In children who take Risperdone on a regular basis, does more than 5 times their current single dose, not daily dose, should be considered potentially toxic. Any child whose developmental age is consistent with an accidental poisoning as non-accidental poisoning should be considered. Now, I want to let you know I'm not a doctor or anything, but I am bipolar and I do know the drugs, and you do have to take tests. You do have to for seizures because some of these medications will cause seizures too. And by the way, if he has autism, even he could have seizures, and this stuff can cause it. They have other medications. That's why it makes me wonder about whether he has autism. But they have other medications. Depakote is one of them that stops seizures. So, history, risk assessment, in intentional overdose or accidental or therapeutic error, amount ingested, time of ingestion, co-ingestants, e.g., alcohol and cannabis may enhance CNS depressant effect. Examination. Toxicity usually manifests within 4 hours. Mild to moderate toxicity, cardiac tachycardia, and hypotension, that's low blood pressure, are common. CNS, depressed mental status, some somnolence, and extra pyramid symptoms. Severe toxicity, cardiac OTC, prolongation, ventricle arrhythmia, CNS, extra pyramid symptoms likely, respiratory depression, seizure, or coma could potentially occur, as well as neuroleptic malignant symptoms. Always check for metacollar bracelet in any unconscious patient or any other signs of unidentifying medical condition, finger prick, marks, etc. Investigations, screening, 12 lead ECG, BSL, paracetamol level, ECG, representation in 4 hours, onset of tachycardia can be delayed up to 30 or up to 20 hours. Sinus tachycardia is common. QT prolongation, rare. Okay. Standard procedures and supportive care. Treat hypotension with intravenous fluids. Hypotension persists. Administer vasopressor. I hate doctors' words. Consider transfer when there is significant CNS depression, seizures, or any other cardiovascular instability. Children requiring care beyond the comfort level of the current hospital. For emergency advice and patients are in pediatric or neonatal ICU transfers. Now, that's what I think. I wonder, um, it sounds more likely that that's what might, in my opinion, and this is just a theory, but if he was taking this medication and took too much of this medication and had a seizure when his mother was supposedly in bed studying and this and that, and she heard a thud and this and that, didn't check on him. Now, he could have had problems after he took this drug. He might have taken too much of this drug because he was all hyper from the day, all the excitement and stuff, and he was all geared up, and bipolar, that's the way they go, way up, and that's what these medications are for, is to level that out in the brain, because and Chris they might have been ashamed of this, but I'll tell you, uh, it's not an uncommon thing, but with what he's gone through in his 15 years of life, uh, his mom and dad getting separated and divorced, and maybe he had well, I know for one that the stepdad did hit him with a belt, and I'm sure he got into his face all the time because he was always complaining about Sebstian getting into his face. But this was a young man, 15 years old, and he probably got tired of seeing that stuff, having him get in his face. But, by some of his teachers, I didn't hear them say that he got into somebody else's space. He charged at his dad before. But, yeah, man, you can get that way with bipolar. But nobody wants to admit that they have anything like that. People, and this is the particular disease that everybody thinks, oh, you're dangerous and stuff, and this and that. No, freaking day. People that are dangerous are the ones that think they don't have anything wrong with them and blame it on everybody else. Those are the dangerous ones. Most people, they get treatment for that. And I've never seen anybody go through that with I've never seen anybody that has bipolar go goofy. Well, my daughter, but she smokes weed, so there you go, right there. You're not supposed to. And she also drinks. So there you go. You ain't supposed to. But most people that stick up for Chris and Katie, they're stupid. They're being duped because he's a controller, and I don't care what anybody says. He controls things. I don't think Katie's scared of him, because if she was scared of him and had problems with him, she had her opportunity to leave when he was gone to work. Listen, my mom had 6 kids. We were young. We were little kids. And my dad and mom were divorced at the time, but he was in 2 wars, and he was an alcoholic. So he'd come on or try to come over to the house. We had our stepdad then, which was his cousin, but he beat on one door in the front and the back. My mom went out the other door in the front with 6 kids and one in her arms, running down about half a mile down the road while he was pounding on the door. So, yeah. And my mom, in my eyes, she was pretty brave, back then. That was a long time ago. Because my dad died in 62. I mean, he was 46 when he died. But yeah, so I think Chris is a manipulator. he manipulates stuff. I also read that his sister did work for the police, does work for Sumner County. I read that. And so this is what in my opinion, that might have happened, even if it was an accident. And then she got scared, you know. But I can't tell you because I wasn't there. But this is just my opinion, and I don't know. But it makes more sense than the rest of it, to what everybody else is doing. Plus, those there were lights on that garage, floodlights, and they disappeared along the time that this thing stuff happened. They weren't in the sockets then, but afterwards, after all this blew up, the lights are back in there. And yeah, so it's kind of fishy to me, you know. And plus, I also seen that those fog lights, those particular ones that they had up there, they also have voice things on them. Some of them do. So I was wondering if they had even that, a voice thing, but they didn't put it back up. It makes me wonder. But anyway, that's my opinion, and I'm sticking to it. But I don't know, you know. Like I say, it's a lot better than some of the other ideas that are out there that are kind of wiggy out, you know. But I mean, if you've seen the YouTube streets and the true crime, man, I'm telling you what, bunch of goofies. Yeah, they're always complaining about each other. They don't care, you know. Can't say they don't care about Sebastian, but we don't care about the other people either. You know, freaking fight amongst yourselves. But this is about Sebastian Rodgers and what happened to him. And maybe we could find some answers. And somebody said that they were cleared of foul play. No. I heard the sheriff say that no one, they're not ruling it out. And no one's been cleared. That includes Seth. So you can forget that idea. And there's a song of this freaking thing. Oh, come on. Oh, let's see. Get this old. I have problems with this stupid thing all the time. Okay, there we go. Well, with that said, took me forever, but just this is food for thought. Thanks for watching, and take care of yourself in this nasty, crazy world that we call Earth. um, be safe. God bless. Thanks for watching.